The Decide project's a project funded by the European Union, and the purpose is to develop and to test ways of disseminating recommendations that are based on good evidence. So the breast cancer screening is a good illustration of the challenges that people have making good decisions about healthcare. And it illustrates the different strategies and target audiences that the Decide project is using. So for example, one decision that needs to be made in relationship to breast cancer screening is what advice should be given to women, what advice should doctors be giving to their patients about mammography screening for breast cancer. And that requires considering things from the point of view of the woman, what's important to her, what the benefits are, what the harms are, and the relative importance of those to her. Whereas if you're making a decision about should the national health system in Italy pay for it, it's a different set of considerations. Then what's important is still the balance between the benefits and harms, but the cost to the health system becomes very important because we always have limited resources. If we spend money on breast cancer screening, we can't spend that money on something else where it might do more good. So the aim of the Decide project is not to make decisions about specific interventions such as mammography screening, but it's rather to develop tools that can be used for any decision that needs to be made within the health services about what to do or what not to do. So other examples that could be considered are, for example, many countries have recently struggled to decide whether or not to pay for the new anticoagulants, which have advantages over warfarin, which is used, for example, for patients with atrial fibrillation, but they cost a lot more, and they can break the budgets of some health systems. So you need to decide, are those increases in benefits worth the large increases in cost? Once that decision's been made in the context of it's either paid for or it's not, what should you tell a patient with atrial fibrillation to help that patient decide should they use one of the new anticoagulants or warfarin, given the fact that they may have to pay for it or they may not have to pay for it?